Okay, welcome everyone. Thank you for joining today's webinar, Competencies in Focus, Community Engagement. My name is Amber Elston, and I'm an analyst with CADCA's Evaluation and Research Team. CADCA, in partnership with the Center for Public Health System Science at Washington University in St. Louis, is excited to present today's webinar, which is the 6th webinar in our 18-part webinar series on CADCA's coalition competencies. Next slide, please. Before we dive in, I just want to do a quick overview of CADCA. Using a community-led approach, CADCA is dedicated to empowering coalitions and health departments across the globe with tools, expertise, and support needed to drive positive change in their communities. Through top-tier training services and an evidence-informed technical assistance system, we help build your capacity to implement best practices that improve community health outcomes. To explore more about our work and subscribe to our weekly newsletter, visit cadca.org. Next, please. I'm sure everyone's familiar with Zoom by now, but I'd like to go over a few housekeeping notes. All participants are muted by default, so for general comments, please use the chat box. We will have a Q&A portion at the end of the presentation, so for any specific questions for the presenters, please use the Q&A box. You will receive a post-webinar email with the recording of the webinar, slides, and an evaluation survey. We kindly ask you to fill out the survey. Letters of attendance are given only upon completion of the evaluation survey. Next, please. And now I'd like to introduce our presenters. Today's webinar will be led by our valued partner, Zara Petkovic, from the Center for Public Health System Science at Washington University in St. Louis. Zara is a project coordinator for research translation projects, including the Best Practices User Guide, a series of publications designed to help states implement effective tobacco control programs and policies. She was involved in producing all aspects of the guides, including research, writing, and editing. Her interests include public policy and community-based interventions. We are also joined by Dr. Brett Maricque. Brett is an assistant professor of genetics at the McDonnell Genome Institute at Washington University School of Medicine. He co-leads the Black Genome Project, a community-based participatory research project exploring the intersections of genomics research, precision medicine, health, and identity through ethnography and design. He works with the Center for Community Health Partnership and Research to advance translational research at WashU through partnerships with community organizations, infrastructure to support faculty conduct community-engaged research, and methods for integrating lived experiences across the research spectrum. Lastly, we are joined by Kristina Clark, a nationally recognized expert in coalition building, nonprofit sustainability, and substance use prevention. As the president and founder of KM Clark Consulting Group, she works with organizations across the country to enhance their capacity, improve their impact, and secure long-term sustainability. Her innovative strategies and evidence-based approaches empower communities to achieve transformative change. Kristina is a trusted national trainer for CADCA, where she has guided hundreds of coalitions through the National Coalition Academy. Her work equips communities with the tools to prevent substance misuse and address public health challenges effectively. Thank you all for joining us today, and Zara, I will pass it along to you.
Yes, so thank you all for joining us today. As Amber said, we're here to talk about one of the CADCA Coalition competencies. The competencies cover 3 areas of coalition work: operations, community, and prevention. And today we're focusing on one of the community competencies, community engagement. So first, what is community engagement? The competency defines it as developing relationships with different sectors, groups, or organizations to implement substance use prevention strategies. And why is community engagement important? The evidence shows that community engagement improves coalition participation and satisfaction, and it ensures that coalition efforts match community needs. Effective community engagement also promotes community ownership of coalition work and expands support to areas that are priorities for the community. Community engagement can also increase coalition sustainability, capacity, funding, and it facilitates lasting change in the community. So next, I'm going to go over the knowledge, skills, and abilities that are part of the community engagement competency. The knowledge that you need to be competent in community engagement includes community resources, so knowledge of community champions, partners, and other resources that can support coalition efforts, community demographics, so knowledge of demographics, norms, and experiences of community members, engagement strategies that the coalition can use to engage and motivate community members, and local history and context, including how that can influence current engagement efforts. The skills that are part of the community engagement competency are communications, which is communicating across sectors via a variety of platforms to gain buy-in and maintain transparency with community members. Public speaking, so speaking effectively to a variety of audiences within the community. Group process, which is promoting community involvement via proven processes like focus groups. Volunteer oversight, so managing, training, and coordinating volunteers from the community. And conflict management, which is dealing with and resolving conflict when it arises. And then finally, the abilities that are part of the community engagement competency are community participation, which is the ability to facilitate meaningful community contributions to coalition goal setting and planning. Community perspectives, which is the ability to gather input from community members and support transparent and accountable decision making. Partnerships, the ability to establish dynamic, flexible partnerships from across the community to support adaptability and problem solving. Community connection, the ability to connect community assets to coalition efforts. Flexibility, the ability to learn about and adapt to community members' needs. Self-reflection, and the ability to facilitate, I'm sorry, I think I copied the wrong description there. And then finally, respectful behavior, the ability to act with sensitivity and understanding. And next, I'm going to pass it over to Brett for an introduction to community engagement.
All right. Thank you, Zara, for passing it along. Amber, thank you for the introduction, and thank you all for the invitation to come and share. And good afternoon, maybe good morning to some. I'm seeing people on the West Coast, at least Mountain Time, maybe some West Coast time as well. So good morning to those. Appreciate everyone being here for this. I'm going to start by introducing myself a little bit. So this is my path to my current role. I'm from Green Bay, Wisconsin. My first job was folding towels for the Green Bay Packers as a high school kid. So you know, for those who can stick around after the session, I'll be giving the real competency lesson, which is how to tri-fold a towel. That's actually my greatest expertise. From Green Bay, I went to the University of Wisconsin in Madison, where I majored in genetics. I did my PhD at WashU School of Medicine in computational and systems biology, which is a mixture of computer science and human genetics. And then I moved to New York City to do a brief postdoc at Columbia before taking a role with New York City's public health agency, New York City Health and Hospitals, where I served as essentially a community health worker, delivering connections to healthcare, mental health, legal services, family services, etc., to adolescents and young adults who were incarcerated in New York City's jail system. So I spent a few years doing that work prior to coming back to St. Louis, where I've been an assistant professor in the genetics department since June of 2020. So coming up on 6 years here. And as mentioned, I have a role in co-directing what's called the Center for Community Health Partnership and Research at WashU, which is a center that provides infrastructure and funding and support for researchers that are interested in engaging the St. Louis community in their research projects. This center is part of the Institute of Clinical and Translational Sciences at WashU and has also been part of the Institute for Public Health, which recently is transitioning into our School of Public Health here at WashU. These two institutes provide resources and support for researchers doing projects across a wide spectrum of subject areas. And I'll share more about that in just a moment and how we can think about the work that many of you are doing in terms of research and program execution and service delivery, all in sort of the same kind of framework. This is the team that I work with at the center, and much of what I'm going to share today has been shaped by each of these people over many years of experience, but also more recently, like in the past couple of years, some really dedicated thinking and brainstorming and innovation in terms of how do you integrate the voices of community members and not just their voices, but their effort and their work into your projects. And so just wanted to share this group and give everyone their credit for the work that I'm about to share that we've been doing. And yeah, just say thanks to the team. So the first thing I want to do is just kind of share a bunch of what I think of as inspiration. So these are a set of guiding principles that come from various sources. And I think these are the principles that ultimately the way we interact with community members, whether it be organizations and the leadership and staff at community organizations, or with individual people who are living in our communities. These are the things that inspire the ways that we kind of move and operate when we're engaging communities. And so I'm going to highlight a few things as we go, but if I'm hoping that these slides can be shared with the group, and if not, that the resources included here at least will be shared. So the first set of inspiration or guiding principles that I want to point out are the principles of community engagement. So these are established by government agencies, including the Clinical and Translational Science Awards a group, NCATs, as they're known at the National Institute of Health. And they really establish like some boundaries and some guidelines for how researchers in particular should interact with local communities. And there's a couple that I would really like to highlight here. Number one, or the first one is number 4, which is the idea that the community has autonomy and has agency, and that there's a level of collective self-determination that is the right of all people in a community, and that no external entity should assume that role on behalf of the community. So this is one really about collaboration and consensus building with community. And then the second one that I'd like to highlight on this particular slide is number 7, which is that the sustainability of community engagement, the long-term potential for a project to be conducted between an organization and the community that they serve, is really about or enhanced by identifying and mobilizing more important than the other 7. I think that these are two that I think can really set you on a a different path than you might otherwise be on if you hadn't followed that principle. So number 4 and number 7 on this particular slide. The second piece of inspiration that I make quite a bit of use of is from a framework developed by John Powell and others at Cal Berkeley and the Othering and Belonging Institute. And this is really around the idea of belonging, of establishing a sense of belonging among the group of people in the community that you're attempting to work with. Meaning that number one, those people feel like they belong in the conversation, that the work that you're bringing to the table is relevant to them, that that there's some shared language that's developed around the work so that everyone can communicate clearly, that there's a sense of ownership that's built over time in the work. And so really this is about, prioritizing some level of structural change in the way that we as institutions work with individual people or others in the community. It's about fostering like an ethos of inclusiveness and of the ability of experts in a particular field to co-create with everyday people who we may be serving. And that it also really recognizes that the various identities and lived experiences of people can ultimately be a point of strength for any research project, program, or service that's being delivered. So belonging is a framework that I think about a lot when engaging with communities. And then the last one, and this may be new to many, and we're going to spend more time talking about human-centered design in a bit as we think about how we go about engaging with community members. But the principles of human-centered design are another source of inspiration. So as we develop plans and programs, it's really important that we're people-centered, that we're putting human beings who need to interact with these in the center of our circle. It demands that we are working on the right problem. So oftentimes this requires us to assess whether we've landed on the right problem to solve. And many times we learn from community members that the problem we're working on isn't the right problem, and we need a way to adapt and incorporate their feedback. Design really encourages us to think of everything as a system, and that people are forced to interact with these systems, and many times it's the system that needs change and not the people that are interacting with them. And then human-centered design also champions small and simple interventions. So things that can be quickly identified, prototyped, and tested through pilot projects. Kind of small and steady wins the race is the idea here. So altogether, like using the kind of institutional principles of community engagement, belonging, and human-centered design as inspiration, we're starting to develop like the beginnings of what a framework for engaging with community can look like. I want to share 2 quotes here before we get any further. One is from Adrienne Marie Brown in her book Emergent Strategy. And this is one really about trust. And so like a lot of what we do and a lot of the principles we uphold are about developing trust within communities. And the idea here is that you can't move faster than the speed of trust. You have to move at the speed of trust. And that focusing on, critical connections rather than the mass, right, getting things done quickly is really what's going to serve as the kind of fabric or the foundation or the resiliency of your project. So it's really about building relationships with key sort of critical members of communities. And then the second quote is one from John Powell from his book, Belonging Without Othering. And he says that we need to be hard on structures and soft on people. And I think that this is a great way to think about the lens we need to bring to this work, that we're here to assess and interrogate the systems and structures that are in place that people interact with, and really bring a lot of empathy and understanding to our interactions with people themselves, and that the combination of these two things can actually take us quite far, even in the absence of any other guiding principles about community engagement. So next, I want to talk about the kind of framework that we use at the center, and think about how this framework is similar or different from what we might use if we're developing programs or delivering services instead of conducting research. And I think about this, if the last set of content was really about inspiration, this is really about preparation, about kind of getting our wits about us, starting to identify like the objectives that we have in front of us. So for us, it starts with a mission. And so we've established a mission that's really about the way that we do business. And our mission is twofold. So, and I'm sharing this as an example of how we turn a goal of engaging communities into a set of specific missions that we can drive towards. So the first part of this is to facilitate and nurture the art and science and partnerships that are required to do community engaged research across research teams in the translational science spectrum. So this means that we're equipping the people at our institution who are responsible for the projects with the tools and resources that they need to carry them out, and that we're not limiting this just to people who are running clinical trials. We're also thinking about people who are doing basic science research, public health science research, really thinking about the entire spectrum from bench to bedside, which I'll share more about in the next slide. The second part of our mission is to do research that responds to community needs and also innovates in the methods, the processes, and the partnerships that support health research. So here, our mission is to really be at the forefront of the ways in which we interact with community to bring their voice into the research process in our case. So this for us really boils down to the concept of lived experience. And we're going to talk a lot more about that in the next several slides. But what we mean here by lived experience is like the collective knowledge that the community has, that they can offer to the research in our case that we're doing, or maybe in your case, the programs that you're trying to execute or the services that you're trying to deliver. And you can imagine that, you know, for us, we think about bench science, maybe people in the lab doing work with pipettes and with cells, all the way up to the bedside, where clinicians may be trying to deliver some intervention in a hospital setting. And that throughout this process, there are various points where the integration of lived experience can really make or break the success of that work. And for those of you who are thinking about what you do in your daily work, whether delivering programs or services or doing research yourselves, like you might already be thinking about places where hearing from those who you're attempting to serve may be beneficial to the way you go about your business. And so I would encourage, you know, you to think about how you would maybe translate this spectrum of bench to bedside into language that's more appropriate for the work that you are all doing. But nevertheless, this is the way we think about it. We really think about how do we efficiently and with integrity integrate lived experience into our research projects that are happening here at WashU. So without like a real game plan, like of how to do this, it's hard to imagine like what comes first, what comes second, how do you know if you're doing well, how do you know where you're failing? And so this step is really about the action, like how do you put this into practice? And this is sort of a full-time job. Like, if you're running an organization and implementing programs, like the way you think about doing community engagement might end up requiring that a dedicated staff member take control of this process, the relationships, the community partners that you're working with, the continuity of that communication is all very important for building trust and building those sort of resilient relationships that will serve the project well. And so this is an area where you might start considering like who on my team is in the best position to be executing some of this work. And I'm going to break this down into like I guess 5 or 6 questions that we like to ask: the why, the what, the how, the who, the when. And I'm going to try to make this as clear and digestible as possible. So I like to think about this first in terms of the why. So why would we want to integrate lived experience into our work streams? And for me, it's about really maximizing or improving the thing that we're doing. So in terms of research, we're creating knowledge. So we want to maximize or improve knowledge creation by interacting with the community. But we can also think about maximizing or improving program execution or service delivery through these same mechanisms. And here we think about lived experience really as data, as inputs about the user needs and preferences that can inform better decision making about what we're doing. So, in the research world, we think about all different forms of data that go into a research project. And more, we're thinking about lived experience from those that are impacted by the work as a key form of data that can help us push the project in the directions that it needs to go. So what is it that we're actually trying to integrate? And I've used the term lived experience multiple times, and I want to just refine this a little bit so you can think about it in the context of your own work. The first thing that I want to modify it with is the word relevant. So it's not that we just want to go out and talk to any community member about any project. It's really about identifying those that have experiences that are most relevant for the work that we're doing. And we may not know the answer to that. So there may be some investigation and some exploring that has to happen before we identify, or in order to help us identify the set of community members whose experiences are most relevant to our work. But many times it is obvious, and that relevant lived experience is of people using a system. So maybe that system is a healthcare system, or that system is a social service access delivery and access system, or otherwise, but really like experience using that system is critical to enhancing how that system works. It could be relevant lived experience in the form of grappling with some problem that we're trying to solve. And if we can bring a set of people into the room who have various backgrounds and life experiences, and they've all been grappling with this same problem, we might, be able to land on some intervention that's well informed. It could be lived experience living with a disease. What's it like to experience that disease? What's it like to get care for that disease? What's it like to share that you're affected by that disease with others? It may be lived experience of seeking information. And what does it look like to try to find reliable, helpful information about solving a problem? Or it may be lived experience with how do I make informed choices given all of the options that I have to, you know, in our case, in research, do we do this experiment or we do that experiment? Do we ask this question or do we ask that question? In maybe a program world or a service delivery world, we're thinking about, given all the options and things that people need to do with their time, how do we effectively integrate the things that we're offering into someone's busy schedule and complicated life. And so how do we help them make more informed choices using their lived experience as a form of data? The who, so who are we convening to have these conversations? And it's really those that are directly or indirectly impacted by the project, program, or service that we're considering. And this obviously includes the end users of those research data, programs, or services, patients, caregivers, other stakeholders within institutions, governments, educational systems, family units, neighborhoods, as well as constituents of the larger system. And so like when we think about the types of lived experience we want to gather, we can really begin to use something like an eco-social theory where we're imagining like the individual at the center of that model, and then kind of building layers beyond that of those who are indirectly impacted by that end user's experience. And we can ask at each layer of that model, like, is the experience of the stakeholder or constituent in this layer of the model relevant to the work that we're doing? And to the extent that the experience is deemed to be relevant, we would think about inviting those to contribute their lived experience to our work. The when is critical. So how do we decide when to go about this? Is it ever too early or too late to be going to the community with a question or a point that we need their input on? And I think the answer to each of those questions is no. However, there's probably more opportune times than others to do it for each of our particular projects. And I'm going to share a few what I would think of as critical periods in the research, programmatic, or service delivery process that we should maybe consider whether lived experience could be helpful. So the first would be the planning and development phase. Like before we even begin to plan and develop a new program or project, is there an opportunity for us to interact with people and to integrate their lived experience into this process? The pre-implementation, like testing phase, like when you've got an idea and maybe you've prototyped a solution or a process that you want to carry out, is there an opportunity to engage community members in pilot testing of that intervention and get some early end user feedback while there's still time to make tweaks? Maybe you've already built that thing, right? Maybe it's a long-standing program or service that you're delivering, and you know that end users are experiencing significant roadblocks to accessing it, significant roadblocks to finding it acceptable or feasible to integrate into their lives. That might be a great opportunity to pause and try to gather some lived experience data to help push beyond those roadblocks. And then finally, like you may have evaluation data or utilization data that tells you that the thing you're doing is being underutilized or undervalued or under advertised in particular communities. And you may want to do some end user evaluation of that as well, and identify ways that the community members are thinking that you could solve those particular challenges. So it's really never too early or too late to think about integrating lived experience. The earlier you think about it, the more opportunities you have to prevent challenges. But you may be well within a project that you want to continue sustaining, but you think needs some fresh perspectives, and even then it's a great time to take a step back and go to those community members you're impacting and ask them for their feedback. And then how do you do this? Like, what does it actually look like? And the first thing I'll say is that there's a enormous number of strategies, techniques, methods that you can think about using for really capturing the lived experience of those that you're interested in hearing from. And many of them are well-developed methods that have been time tested and utilized across a wide variety of settings. Um, I'm going to share three areas here, which I think could be relevant to many of you. So the first is this program that we run at the center called Community Studios. And these are really one-time sort of advisory meetings where we recruit a particular group of people that have a set of lived experience that's relevant to a research project, and we bring them all into one room, and we have a professional facilitator, kind of guided discussion between the research team and the community members that are there to participate. And researchers will often walk away with insights that they never imagined, with sort of tactical advice about how to solve a problem, with new research questions that they hadn't been considering, or with strong connections to people that were in that room that they end up following up with and working with in the future. So the studio model is one that's very strong. And there's some published work describing this and more to come from our center as well. The second set of tools is this thing called human-centered design, which I mentioned, which is really about like understanding the needs and preferences, desires, questions, concerns of those you're interacting with. And there's a set of like, there's hundreds of human-centered design activities that you could do to elicit these feedback from community members. I'm sharing three here. One is called journey mapping, where you're sitting with someone one-on-one and you're kind of walking through either a day in their life or their more specific experience interacting with that system or trying to tackle that problem. And you're trying to understand kind of the context for all of those interactions so that you can identify variables that are affecting people's ability to interact with that system or solve that problem that you may not have been thinking about before. And there's really nice templates that are available for how to do a journey mapping session, which we can share. Walk a mile is something where you might identify someone from your team who could actually stand in or sit in on meetings or experiences that people are having. So in a project that we're currently working on, investigating how people access primary care, we are actually going to be sending, I guess you could call them secret shoppers, that are going to, attend an appointment with an individual, not to advocate or intervene on the appointment, but rather to observe how the appointment goes and to make note of things that are occurring during that appointment that that are barriers to primary care access, but also facilitators of primary care access. And then the last one is this thing called How Might We, where you kind of pose an open-ended question to a group of community members, like, how might we improve transportation to primary care appointments in our city? And you really invite people to brainstorm very broadly about the things they can do to intervene on this problem. And then lastly, there's a set of qualitative research methods that are really good, that really come from the field of ethnography, that allow for relationships to be built, but also for lived experience to be captured during the meetings. So you can think about focus groups, which might be 8 to 12 people that are guided through some conversation. You could think about semi-structured interviews where you develop an interview guide of questions that you're going to ask every person, but then based on their responses, you kind of do a little bit improvisation and ask follow-up questions that might differ between each person. And then participant observation is another time-tested strategy to really see with your own eyes how someone is interacting with a system or trying to solve a problem. And so these qualitative research methods are really valuable for developing an understanding of the variety of lived experiences that you're interacting with. Much like the kind of keeping track of this game plan can be a full-time job, just this part alone could be a full-time job, right? So like just being the methods person or just thinking about how do we execute the methodology of this could be an area where someone needs dedicated time, and maybe even some dedicated training to make this happen. I think one piece of good news about this is that more and more there are centers like our own where there's sort of consolidated expertise that not just researchers, but also community organizations in the St. Louis region can reach out and ask us for help. And that's what we're here for. There's also a set of like really good online resources for doing some training of members of your own staff that we could share. And I would just wanted to point out that this alone could become overwhelming to some who don't have a research background or who don't have experience engaging communities, and that the whole reason our center exists here at WashU is to support researchers in our case who don't have this experience. And so it's totally reasonable that many of you and your organizations don't have the skills within and may need to reach out and identify resources that can assist with this. And I'd reassure you a little bit that those things are out there, and I would be happy to connect any of you with some of those things if it's something you're considering. I want to finish here with just a couple quick examples of how we've carried this out in our own work. So the first example is a project that we call Our Community, Our Health. This began as with the goal of delivering COVID and flu vaccines to neighborhoods in St. Louis where the data was telling us people were, number one, under vaccinated given guidelines, and number two, experiencing an outsized burden of COVID related and flu related illness. And so we established a pop-up tent version of a clinic that we partnered with Centennial Christian Church, a local library, as well as a municipality that's in St. Louis County. And we had consistent pop-ups with this vaccine tent where people were receiving this service of vaccination. And all along the way, we were doing kind of small common sense things to be good neighbors, to build strong relationships, to listen to people's feedback about how their experience was going, and to make upgrades to the vaccine operation itself. And about halfway through this work, we decided to do some human-centered design work to specifically respond to the experiences that people were having with our vaccine tent. And so we did a set of journey mapping sessions with vaccine recipients to really capture their lived experience and integrate it into our operations. And so this picture here, this isn't an example of one of our vaccine journey maps, but it's an example of what the page looks like at the end of one of these sessions. And it's really about mapping like all of the stages of a person's day in this case, and what are the things and people and places that they interact with throughout that day. And what we're trying to do here is identify barriers in their day that prevent them from accessing vaccines, and also opportunities that we can identify to integrate a vaccine program into their kind of daily lives. And so these kinds of sessions usually take like about 60 to 90 minutes each, and they really get down to a very granular level of detail if that's where you want to go with them. So this is one way in which we've used human-centered design to integrate lived experience into our work. And through these journey mapping sessions, we identified several needs that were related to vaccination that we've been since following up on with additional projects in the neighborhood. And so it's been a way to identify community-driven research questions that we can collaborate with neighbors on. And then for my own personal work in the genetics department, I've been working on the Black Genome Project with my collaborator Chelsea, who's seated next to me here in this interview setting. And we've incorporated a variety of community-based participatory methods into our work, including a community advisory board that's responsible for like co-creating and co-designing the future iterations of our work. We've established what we call a community education collective, which is a group of community members here seated in this circle that are developing educational resources to share about genomics and precision medicine in the community. And then we've really like invested a lot of time and effort in building one-on-one relationships with those who've participated in our research. And here on the bottom right, you can see a yoga session where we brought in a professional yoga teacher to lead a set of yoga sessions on a Saturday for our participants. And this is just a way to, again, invest in those critical relationships and not sort of in the mass, in going fast. And this has all benefited us quite well. This project is now 5 years ongoing, and many of the people that were there on day one are still showing up to our meetings and sharing their lived experiences 5 years later. And so happy to share more about this work with anyone who's interested. And then, yeah, I'm just going to stop there, say thank you. I don't know if we want to take questions now or at the end, but happy to take them now if we want to do that.
Everyone can drop their questions in the Q&A box. We can go ahead and have Kristina do her slides, and then we can ask all the questions at the end.
Perfect. Thank you so much. So much great content and incredible coalition people in the room as I see everyone talking in chat. So my short role here is say, what can you do? How can you take this information and move it to action in your communities? So next slide, please. The first thing I want to talk about is, as you were seeing all of the core competencies, I know because I know there's some incredible people in the room like Kay and Angela and Jerry that I saw that you were looking at those core competencies and you're like, I do that. I do conflict resolution. I'm good at this. And what I want to challenge you with is that this is a coalition core competencies, not just yourselves. And so one of the things I want to challenge you with as you go back to your coalitions is to figure out how do we make sure that our coalitions, our partners that we're working with, also understand these core competencies for community engagements. How do we build that into the culture that we're setting? And that's why I have at the very bottom here, model the behavior you want to see, which is a lot of what Brett was talking about. It's like, if we want people to show up, if we want them to feel like we're not doing something to them with them, then we need to be constantly having this conversation. And I want to echo what Brett was talking about, as well as the idea that we do need to be having those conversations. There needs to be point people to have this. And that's why we need to practice this behavior. It can't just be living within just Kristina or just Jerry as we go out in the field. The information on our partnerships, how we're talking to people who we're working with, who we'd like to work with, we need to get really strategic and intentional about getting other people to understand understand and do that work. And so how can we do that? Those are some of the ways to activate this in your coalition, is to first sit down and figure out if everyone's on the same page about the relationships and partnerships we currently have. How are we talking to students? So we could do something like a journey map with our students and our high schools that we're working with. What do those relationships look like? Who else is engaging with those key stakeholders to make sure it's not just living with one person, and so that we have lots of other people collecting this data and talking to them? Because like Brett said, this could be a full-time job that all of us don't have that as a volunteer group, right? So how can we build that muscle within the coalitions? How can we host some of these inclusive community dialogues and listening sessions, kind of like what Brett was talking about in terms of those listening sessions that we can put into place? How can we make sure if we're about to do Red Ribbon Week events and campaigns we're going to do, how are we talking to youth, how we're engaging with parents on that? And part of what I'm talking about is that developing that volunteer leadership pipeline. What I mean by that is that transference of knowledge of how we do community engagement. How do we grow that muscle? How do we make sure that our community members understand that they're part of this, that they're building these relationships with us, that people's voices are important? And so as you go back, look at your strategic action plan. How can I add someone else's name to this? How can I train up someone else to understand this work and how we can better engage the community? How can we collect more data and get more voices at the table? And part of that is creating those tailored messagings. If you've ever been in any training with me, you've heard me say one-sheeter does not fit all. So be thoughtful about how we're talking to different groups of people. If we're looking at engaging parents, different parents at different levels from elementary to middle school, what is that messaging? So we really can speak to them and go to where they are to get some of the information like Brett was referring to. And I think as terms of this, we have to be better about incorporating reflection and storytelling within our coalition meetings. And what I mean by that is take time to build those relationships while you're there. Take time to talk about what works, why it doesn't work, what's going on in the community. So you're building relationships while collecting data that can help you do some more of this informed community engagement that you want to see. And so I'll end with where I began, which is to really say, model the behavior that you want to see. If you want to see people working together, people listening, people coming together for your programs, you have to be the first one to step out of the door and start asking those questions and engaging with people where they're at. That I'll hand it over to Amber.
Thank you, Kristina. So you might be wondering how I can increase my coalition's knowledge, skills, and abilities in community engagement. Next slide, please. Well, here at CADCA, we focus on crucial competency during our National Leadership Forum and Mid-Year Training Institute through various coalition services, training programs, and through our National Coalition Academy. Next, please. In fact, you can see on this slide, community engagement is explored in depth during each week of the NCA. Next, please. Thank you. So while we are moving into our Q&A, I'm going to go ahead and put the evaluation survey in the chat. And Zara, if you will put it here on the screen, we kindly ask that you take a moment to complete the evaluation survey by scanning the QR code or using the link in the chat. Please note that letters of attendance are given only upon completion of the evaluation survey. And then let's move on to Q&A. Please remember to put questions in the Q&A box. Okay, so there's a question here that says, we have struggled to get people involved in coalition activities since the pandemic. Do you have suggestions for how to get community members involved in the kinds of activities you recommended?
Yeah, I can share a couple ideas here, things that we've done, because much like you all, we've experienced this too, having started our project like actually post, like right kind of in the middle of the pandemic. One thing we've done really well is to go to where people already are. And this kind of sounds obvious, but almost all of our recruitment for our research projects has been by showing up where people already frequent and beginning conversations with them in a comfortable place, in a space where they're already used to being. And and I think this has really paid off for us. Like we've been able to access some communities who've been historically excluded from research and who've in fact been harmed by research, and biomedical systems, themselves are aware of histories of harm that have taken place. And it's really been through these like conversations on people's own turf that we're able to kind of break down some of the hesitancies or barriers to participation that people have, um, such that like when we maybe reach back out or see them again, the invitation to participate is really sort of like a warm like it's a very warm conversation. It's there's a process that we've taken to take tiny steps towards asking people to share their time and effort with us. So to the extent that you can like get out into the world and be with people in their local kind of neighborhood level spaces, that is very, very powerful. Um, I think one other thing that we've done, I think really effectively is modeled how people's lived experience can impact the work we're doing, like from the very first sets of conversations. So like being able to acknowledge concerns that people have, being able to respond to questions that people have, I think is really important, because it's like the first moment you're able to establish some trust and some camaraderie with others. And so that's been really effective as well. Um, I see a couple. Should I just respond to a couple of these other ones too, Amber? Or
Yeah,
yeah,
you can go ahead.
there's a question here about ways of hosting different types of sessions. Um, so that folks don't feel, so that you can create sort of an open forum. And I think one thing here that we do across the board is use a set of community norms. So at the very beginning of any session, we establish like the ground rules for the space. And this opens up, I think, quite a bit of opportunities for people to share without feeling like they're being singled out or targeted. So those are some things that I could share resources on, like how to develop community norms, either through a consensus process or by your team establishing them and getting people to agree to those prior to the beginning of the session. Um, there's a question about the set of engagement activities you could use and wondering whether there's a better fit for people of different ages or backgrounds. And I think the answer here is absolutely yes, that there are some activities that certain people respond really well to, and there are other activities that others respond well to. And so we often will pair like a set of activities up so that the same group of people is able to participate in that variety of activities. So maybe people aren't good in a group, but they are good like in a one-on-one setting. And so we will follow up focus groups, for example, with one-on-one interviews with individuals who've participated in those focus groups as a way for them to build on the things they shared or to share new things that they weren't comfortable sharing within the group setting. I think a variety of virtual and in-person activities is helpful. And then I think a variety of activities where you're asking someone to maybe read and respond, like in the case of a survey, versus to enter into like more of a conversation where reading levels and comfort with like responding to test like questions aren't as much of a consideration. And so this is something to think through as you're developing like a plan for how to engage the community, is what is the type of variety of activities and modes of interaction that you want to include. And then last question here that I'm seeing is around like establishing an effective feedback loop when you're collecting data from the community. Something that we've done here is we've created a community data analysis team for the Black Genome Project, where it's actually participants in the research that have decided they want to co-analyze the data with us. And through that community data analysis team, we've identified ways to like share back results with community members, but also engage them in like additional conversation around the data we're collecting. And so I think like establishing some kind of group that's responsible for the dissemination of the research findings, but also in like managing the kind of back and forth between the research team and the community is really important. Like that consistent voice that's doing the communication, but also the consistent like brain power that it takes to continue to stay on top of those things is key. And I think prioritizing that would actually be something that's that's worth doing if you're thinking about a partnership that really depends on deep engagement of the community, or like a really long-term partnership with the community, because it's those kind of feedback loop type interactions that can really like grow the roots of trust that you've already established.
Thank you. Since we're going overtime here, I just wanted to note that all of the questions in the Q&A box that haven't been answered, they will be emailed to the presenters later on to answer, and then the responses will be emailed to all of the attendees. So just a last few housekeeping things. Sorry, could we switch the slide really quick to the last slide? Thank you so much. So as we conclude the webinar, we want to give a big thanks to our presenters for sharing their work and insights, and we want to thank the webinar attendees for your participation. Our next webinar will be on December 12th at 12 p.m. Eastern Standard Time, and it will cover the leadership competency. Be on the lookout for the email with the registration link. And then last slide. Oh, if you have any questions about today's session or where you can find community engagement at CADCA, please feel free to contact Abby Nellis at anellis@cadca.org. I'll put her email in the chat as well. And thank you again for joining us, and we hope you have a wonderful rest of your day. Thank you. Gonna end the presentation here. Thank you both.
Thank you.
A good one.